What is a mucinous cystic neoplasm, MCN? Imagine a small, fluid-filled sac developing inside the pancreas, mostly in women between 40 and 60 years old. This is a mucinous cystic neoplasm, or MCN, a type of cystic tumor that forms in the pancreas. These cysts are lined with special cells that produce mucus, a gel-like substance found in mucous membranes. The cysts are surrounded by a unique tissue that resembles ovarian stroma, which is why they are often called ovarian-like stromal tissue. MCNs are considered premalignant, meaning they have the potential to turn into cancer if left untreated. About 1 in 10 MCNs may develop into invasive cancer over time. That's why early detection and removal are important. When caught early, surgery can often remove the cyst before it becomes invasive, leading to a very good outlook for the patient. These cysts usually form in the body or tail of the pancreas and do not connect with the pancreatic duct system. They produce mucin, which can be seen on imaging tests. Doctors typically use computed tomography scans or magnetic resonance imaging to identify these cysts. If the images are unclear, they may perform an endoscopic ultrasound with fine needle aspiration. This procedure allows doctors to extract some fluid from the cyst for analysis. The fluid can show whether the cyst is a mucinous cystic neoplasm and help assess the risk of cancer, but it cannot always definitively rule out malignancy. Certain features increase the chance that an MCN might be cancerous. These include larger cyst size, solid areas or nodules within the cyst, and elevated tumor markers like Ca19-9. Molecular testing of the cyst fluid can reveal mutations in genes such as CRAS, TP53, and SMAD4, which are associated with progression from benign to malignant states. The main treatment for MCNs is surgical removal. Surgeons often perform a distal pancreatectomy, removing the part of the pancreas containing the cyst. Sometimes they preserve the spleen if possible. Advances in minimally invasive techniques, like laparoscopic or robotic surgery, have made the procedure less invasive, with shorter recovery times and less blood loss. Understanding the molecular makeup of these cysts helps doctors determine how likely they are to become cancerous. Mutations in low-grade cysts often involve CRAS, while more advanced or invasive cysts may have mutations in TP53 or SMAD4. This information guides treatment decisions and helps monitor the cysts over time. In summary, a mucinous cystic neoplasm is a mucus-producing cyst in the pancreas that mostly affects middle-aged women. While it has a risk of turning into cancer, early diagnosis and surgical removal usually lead to excellent outcomes. Regular checkups and close monitoring by healthcare professionals specializing in pancreatic health are essential to manage these cysts safely and effectively. If you or someone you know has a pancreatic cyst, consulting a healthcare provider is the best step to determine the appropriate course of action based on individual circumstances.